Have you ever asked yourself, what is psychotherapy and do I need it? I get this question a lot. In today's video, I plan to explore this very question, so stay tuned. Hi, and welcome back to my channel, where Psychobabble is unbabbled. I'm Lewis-Hazan, a licensed professional counselor, here to help you increase your knowledge and awareness of all things related to therapy and to help you live a life that is well, wise, and wonderful. So do you need psychotherapy? The short but complicated answer is yes, no, and maybe. This is going to sound odd coming from a therapist, but therapy is not the end all to be all. And therapy is not for everybody, but psychotherapy is for anyone who thinks that they need it. I think it's important to note that psychotherapy is not just for people struggling or suffering with chronic mental health disorders. If you're human, and I think that you are, and you live long enough, you will experience some ups and downs in life. While most stress is temporary, and most people can deal with it on their own, some stress can seem unmanageable and overwhelming, and it can seem unending. When you find that you can't cope any longer on your own and you really just don't know what to do, this is where psychotherapy can come in. So let's define psychotherapy. I'm gonna get on nerd girl on you, I just want to warn you. So when you look at the word psychotherapy, you see two words, psycho plus therapy. And the word is derived from two Greek words, psyche meaning soul, mind, and spirit, and therapia meaning healing or service rendered from one to another. So literally, engaging in psychotherapy is an effort to heal your soul, mind, and spirit. Psychotherapy is basically talking to a trained professional about your problems and symptoms when you no longer can manage them on your own. Psychotherapy is also known as counseling, therapy, or talk therapy. And what it is a mental health treatment used to deal with problems that you have with your thoughts, emotions, and behaviors. As I mentioned before, people typically think that psychotherapy is only used to treat chronic mental health disorders such as anxiety, depression, ADHD, OCD, substance abuse, or trauma. But psychotherapy can also be used to treat milder symptoms, such as going through a life transition or going through interpersonal relationship issues, or trying to figure out what you want to do with your life. It could be career stress, or while you engage in self-sabotaging behaviors and you can't get to where you want to go in life. Psychotherapy comes in different modalities such as individual, couples counseling, group therapy, and it can be administered to adults, children, or adolescents. And there are many different ways in which a therapist will approach psychotherapy, the most common being behavioral therapy, cognitive therapy, psychoanalytic therapy, humanistic, and integrative or holistic therapy. And in a future video, I will go into detail about each of these therapies and what they entail. And as I mentioned in my previous video, the trained professionals are your psychiatrists, your psychologists, your licensed professional counselors, social workers, and marriage and family therapists, and also psychiatric nurses. If you want to know about what differentiates each of these professionals, please check out my video called The Who's Who and What We Do about how to choose a mental health provider. In the show notes below, there should be a link to that video, and there may be or should be a card up above. So please look for that. So why not just talk to friends and family? Now, if you have really great friends and family who you can confidently confide in and who will provide reliably sound advice on a consistent basis, then great. But friends and family are definitely not unbiased or objective, and they are not professionally trained to empathically listen or to provide evidence-based therapies and interventions that can help you. Another thing about friends and family, they are going through life the same way you are and dealing with their own problems and issues. Can they be there for you sometimes? Sure. Can they be there for you on a consistent basis? Probably not. The beauty in talking to a therapist is that you're talking to a stranger. Sometimes it's just easier to talk to a stranger who is unbiased and objective because they don't know you or they don't know you well yet. When someone is unbiased and objective, you can hopefully be more free to talk about your problems and get honest feedback. Also, with a therapist, you are talking to someone who has spent years of education and training with the sole aim to help improve the mental health of others. Again, most people can cope with stress and problems just fine on their own, but a lot of times people's coping strategies are not positive or effective. The truth is that effective problem solving or coping strategies are not taught to the masses. And most of the time we are just making it up as we go along and hoping for the best. Oftentimes you are unaware of what drives and triggers you. And when you haven't processed, acknowledged, or reconciled past pain, trauma, and disappointment, they will continue to negatively affect you. Through the process of therapy, you will work to make the unconscious conscious by increasing your self-awareness, understanding your maladaptive behaviors, and addressing internal conflicts. Once you process and do the work, you will hopefully be more freer to express your needs and wants and be able to make positive behavioral changes. Another thing about friends and family, even if they are a trained professional, having a conversation is one thing, but ethically they cannot take you on as a patient because there's an automatic bias. They know you, or they think they do. They know parts of your history, and they probably already have formed opinions about you. Therein lies the bias. Also, unlike friends and family, therapists are legally and ethically bound to maintain your confidentiality. We cannot, except for with your consent, talk about you or your case with anyone. In a future video, I plan to go over what the limits of confidentiality are, so please subscribe to the channel and hit the notification bell so you don't miss that video. And so what's involved in psychotherapy? Psychotherapy is going to involve commitment, and it's really a commitment to yourself. And the way I see it, it's a form of self-care. It's going to require mental and emotional engagement where you really work hard on yourself. Therapy is going to involve patience, and time-wise, therapy happens on a weekly basis for 45 to 50 minutes a week. Based on your readiness and the severity of the issues you're coming in for, therapy can last 4 to 6 months on the short end, or it can last a year or more. Honestly, deep-seated problems didn't develop overnight, and they're not going to be fixed or resolved overnight either. So again, it's going to involve patience and engagement from you to do the work. So what does therapy feel like? Well, in the beginning, it's going to feel uncomfortable. You're talking with a stranger about your problems, but within a few sessions, you should feel a little bit more comfortable and begin to build a rapport with your therapist. Also, within a few sessions, your therapist or a good therapist should be able to answer any questions you have about the therapeutic process and also discuss their plans to treat you. Another thing, in a few sessions, you should be able to assess if the person is a good fit for you. However, if you, after a handful of sessions, really don't feel like it's a good fit or you don't feel comfortable talking with this person, feel free to find another therapist. But perhaps you might want to have a conversation with your therapist first to explain why you feel uncomfortable, and hopefully it can be resolved. And if it can't be resolved, feel free again to find another therapist. Trust me, and I'll speak for myself and probably for a lot of other therapists, our feelings will not be hurt. And I'm gonna tell you why. Our work and our hope is for everybody to get the help that they need wherever they can positively get it from. Find whoever feels right for you. You're going to be engaged in a relationship, a professional one, for some time with this person. So you really do need to feel comfortable. So keep that in mind. So let's talk about what therapy isn't. Even though therapy is talk therapy where you will be talking a lot about yourself, it is not just a paid service to have someone listen to you talk. Therapy should have an aim to solve a mental health issue or problem. Therapy should be a collaborative professional relationship to help treat a mental health issue when you no longer can manage on your own. Also, a therapist is not going to tell you what to do. I often hear people reluctant to come into therapy say, I don't want anybody telling me what to do. Or conversely, people come into therapy and they say, I want you to tell me exactly what to do. A good therapist is not going to tell you what to do or make decisions for you. However, that's not to say that a therapist is not going to be honest with you or challenge you or be directive in terms of homework or things that you have to do within a treatment protocol. That's about the only time that a therapist should be telling you what to do. A good therapist should be armed with intel and resources and up on their latest research, therapies, techniques, and interventions, all to help you. A therapist will present you with information and encourage you to try it, but that's all that we can do. As my mom and my grandmother would say, you can lead a horse to water, but you cannot make it drink. And honestly, if you're doing therapy right, most of therapy happens outside of therapy when you're not with a therapist. So when you leave therapy or you leave the session, it's really up to you to make decisions for yourself about the changes you want to implement in your life. And when you're by yourself, the therapist is definitely not telling you what to do. So let's talk about goals and what you want out of therapy. Therapy should not last forever. Even with psychoanalytic therapy, which can last a long time, therapy should have an end game. And this is why it's important to have goals when you come into therapy, or some semblance of a goal. It does not have to be precise. It can be something as simple as, I don't want to be anxious all the time. What I ask patients sometimes, how do you want to feel, or where do you see yourself at the end of therapy or 6 months from now? So ironically, I typically tell people up front that I am not going to fix you. My job is to help you fix yourself, because honestly and deeply, I think that all people know what it is for them to live a rich and meaningful life as they define it, not as I define it. But sometimes you just need a little guidance to see it. So in this regard, I kind of see therapy as just a bridge over troubled water. And when you embark on any journey, you may cross a bridge, but you are only going to be on the bridge for a short while. Staying with the traveling analogy, I also see myself as a therapist kind of like GPS. So when you want to go somewhere, you enter your destination into GPS, and what GPS does, it uses the eye in the sky or satellites to calculate the best possible route for you. So it's my job simply to keep you on track, to get you to where you want to go. And just like GPS, if you get off at the wrong exit or make the wrong turn, what will GPS say? It will say recalculating. So let's talk about what psychotherapy should be. Psychotherapy at all times should be a collaborative therapeutic alliance between two people to reach a mental wellness goal. And that's important. It should be a mental wellness goal. And at the very least, therapy should feel like a warm, empathetic, non-judgmental space where you feel understood and comfortable enough to begin the journey of self-improvement, exploration, resolution, and personal growth. So I hope this answers the question about what psychotherapy is, and a little bit also about what it's not. And I also hope that you feel a little bit more comfortable that if you want to get help, you will reach out to get the help that you need. In the future, I plan on making a video on the ways to find a therapist, so be on the lookout for that. And as always, if you found this content to be helpful, please like it, subscribe to the channel, and hit the notification bell so you never miss the latest content. And if you think someone else would benefit from this, please share it. And until next time, I hope you will be well, wise, and wonderful.